Thank you. Great, thank you. And just make sure everything's... well, it's a real pleasure to be here tonight. And I actually hail from the west end of the GTA, so it's wonderful to be visiting the East End.
Welcome to the East End.
And see the spirit that's obvious in the room here. So thank you so much. And I'm really pleased to speak to you about the health impacts of gas plants around this larger discussion of the Portland's Energy Centre. And thank you to Corey for the introduction. I want to talk to you, start by acknowledging TERRE and the amazing work that you've been doing. This is a quote that's maybe a little bit overused, but I thought it was so apt for your group, and about the power of a small group of people to really change the world. So thank you for doing what you're doing, and I'm looking forward to some good outcomes. So we'll dive right in. Thank you. I'm a little shorter than everybody else. So just a quick introduction, and then we'll talk about the health impacts of climate change and of air pollution, the results of burning the gas that burns at Portland's, and then try to narrow down a little bit more on the health impacts of the Portland's Energy Centre itself, and then open it up for more discussion. Just a quick word on introducing the groups that I'm affiliated with. The Canadian Association of Physicians for the Environment, or CAPE, is a non-profit physician-directed organization, and we try to work at the intersection of health and environment to secure health for all by protecting the environment. And we work with governments, with policy work, campaigns, education, research, and media, and more. And the Ontario Climate Emergency Campaign, which is open to anybody in this room to join. It's a non-partisan environmental democracy movement to promote awareness on environmental issues and to urge political leaders to sort of forward progressive climate action for a democratic voice. We have a coalition type of structure with multiple sectors represented, so youth groups, seniors groups, health groups, environmental groups, all across the board. Currently we have about 275 organizations on board, individuals, and representing around 850,000 Ontarians. So we hope to keep growing and use our voice together. And we work on collaborative actions centered around a scientific or science-based 12-point climate action plan. So let's look at the concept of planetary health. The idea that a healthy planet and healthy people are two sides of the same coin. So we can't have one without the other. And when we think about burning gas and how it harms human health, there's sort of two sides to that coin as well. So on the one side, we have carbon pollution when we burn gas, and that leads to greenhouse gas emissions and climate change. And on the other side, we have air pollution, what we're going to talk about as well in air quality, and that's by generating particulate matter and toxic gases, especially nitrogen oxides, and that's going to show up a little bit more in the talk. So let's look at the pathway of climate change first. Climate change is now recognized as the single greatest threat to human health of our time, and our very survival is at stake. And this quote comes directly from the World Health Organization. This poster is made by the Canadian Medical Association, and it tries to show the many different impacts of climate change right across the country, as you can see here. Let's delve into that a little bit. So for instance, extreme weather, and especially extreme heat. The 2021 BC heat dome has now become the single deadliest weather event in Canadian history, and 619 people perished in that heat event. And where there's heat, there's also fire. So planetary warming is fueling increasingly severe wildfires, which generate health risks of their own and further escalate carbon emissions. And of course, last year we saw the worst ever wildfire season in Canadian history, and this year we're already off to quite an ominous and early start. And then the climate crisis is also affecting housing and food security, and these are both social determinants of health for obvious reasons. Furthermore, about 60% of infectious diseases may actually be increased or worsened through climate change, which at the same time is increasing antibiotic resistance. And this is a great concern in the medical community. So already right here in Ontario, we've seen the rise of West Nile, Lyme, pandemics such as COVID. These are all made more probable with climate change. And in the near future, we may actually start to see diseases like malaria, dengue, yellow fever, which have never actually originated in these regions before. And there are also devastating mental health impacts of climate change, and unfortunately these are borne especially by our youth. Canadian studies have showed associations with depression, suicide. A massive global study of 10,000 youth recently showed high levels of daily climate anxiety. Youth who are hesitant to have children. And the majority of youth around the world currently feel that governments are betraying them and future generations. So this is our chance to try to get governments to do better. Let's turn to the other pathway we talked about now, which is air pollution. So first of all, let's understand a little bit about what's in air pollution. Of course, there are many, many more components than what I've listed here, but I've listed here the 4 primary or key components of air pollution that pose health risks. So these include particulate matter, ozone, which is ground level ozone, not what we think of up in the atmosphere, nitrogen dioxide, and sulfur dioxide. And I've highlighted the nitrogen dioxide because that is the key pollutant that is linked with portlands. So how big is this problem of air pollution? Well, it turns out it's pretty big. Around the world, nearly 7 million people die every year prematurely, simply by breathing polluted air. And that translates to over 15,000 Canadians and nearly 7,000 Ontarians every year as well. And if we stack it up against other health risks around the world, it's the red bar at the very end. It stacks up pretty high, right up there with secondhand smoking. And in fact, about 1 in 5 premature deaths around the world is actually attributed to air pollution. So how does this happen? Let's look at the system-by-system impacts of what happens in our bodies when we are breathing polluted air. So I wanted to point out, first of all, an excellent report that was published by CAPE. It was called the Traffic-Related Air Pollution Report a couple of years ago, 2022. I provided a link if people want to look things up. And this was a synthesis of almost 1,200 scientific articles from around the world. And based on all of that information, it came up with summaries of health impacts, epidemiology, and equity, and made recommendations based on the findings. So when we are exposed to polluted air, when we breathe it in, the health harms occur primarily due to particulate matter, especially the smaller ones, which we call 2.5s, and nitrogen oxide gases. They pass to our lungs and then right across our lungs into our bloodstream, where they have access to the rest of our body and can cause disease in multiple parts of the body. So of course, we expect lung disease, so things like asthma and COPD are highly linked, also things like bronchitis, pneumonia, and so on. But it's also linked with heart disease, so things like heart attacks, irregular heartbeats, high blood pressure, and blood clots. A recent study showed that by taking young, healthy adolescents and having them breathe polluted air, within 2 hours we're able to detect irregular heartbeats. These are really concerning. We find we're much more sensitive to these impacts than we ever realized before. Let's carry on. There are impacts in the brain, things like stroke, dementia, ADHD, and more. Again, another very well done study, what we call systemic review or meta-analysis, or the highest level of research we can do, shows that even a small increase in pollution in our air raises the risk for dementia. The endocrine system is affected. So just by breathing polluted air, we can develop diabetes and obesity. And it is definitely linked with multiple cancers, most strongly lung, leukemia, and breast, but others as well. And air pollution poses serious health harms to pregnant women and babies, including low birth weight, prematurity, stillbirths, and birth defects. It is also known to increase the impact of COVID-19 in terms of transmission, susceptibility, and death. The COVID virus actually sort of hitches a ride with particulate matter when we breathe in polluted air, gets down into our lungs, and lungs that have been breathing polluted air are already inflamed and more susceptible to becoming infected. So it's a whole chain of events. And air pollution is an independent risk factor, so independent of climate change, it is also increasing antibiotic resistance, and it is also linked with mental health impacts, including depression and suicide, again with very strong, well-done research. So that's a lot. In terms of equity, there are equity issues here as well. So around the world, about 99% of people actually breathe air that does not meet the latest WHO standards for non-polluted air. And the WHO sort of increased or made their standards more stringent a couple of years ago, about 2021. And of the over 4 million deaths that occur every year due to outdoor air pollution, the remainder being indoor pollution, about 91% occur in low and middle income countries. So at least we're lucky, we're very lucky there to be in Canada. But even here in Canada, there are definite equity issues. Lower socioeconomic status is linked to higher air pollution exposure, higher health risks, and yet greater barriers to accessing healthcare when it's needed. And in the US literature, the same trends are shown for racialized persons, although in Canada that research just hasn't been done yet. We know that increased levels of, for instance, traffic-related air pollution occur within about a half a kilometer of major roads. And in fact, 1 in 3 Canadians live within even half that distance, about 250 meters. So this is sort of a backdrop of what we're already dealing with in terms of the burden of air pollution on our bodies. And then, let's try to look at the health impacts of nitrogen dioxide and try to tease that out a little bit from the other pollutants. It's very difficult to do, but I'll try to present to you a little bit about what we know. First of all, nitrogen dioxide is produced primarily by burning fossil fuels, so that can be coal, it can be oil, and definitely it can be methane or fossil gas, what's being burned at Portland's. And when we are exposed to this NO2, once it hits our lungs, any moisture will actually convert it into acids, so it turns into nitric and nitrous acids, which actually start to inflame and damage our lung cells. It also generates free radicals, which attack our DNA and cause mutations. And this can lead to autoimmune and inflammatory diseases. And it affects the function of some of our immune cells, such as macrophages, which increase our risk of infections. So symptoms of NO2 exposure, most typically the average person might encounter low levels when it comes to breathing or just air, and that would be things like coughing, wheezing, shortness of breath, lung spasms and swelling, which sort of cross over into asthma. But at higher levels, it can cause burning, throat swelling, upper airway obstruction, and even be fatal. With chronic exposure, one of the strongest links is with children developing respiratory infections and asthma, and some of these can develop into permanent restrictive or obstructive lung diseases. So in terms of, if we try to make a list of, as I said, sort of trying to tease out the health impacts of NO2, trying to separate it from particulate matter, you'll see the list here overlaps quite a bit with the list I showed you for air pollution in general, but we know that just with exposure to NO2, there's definite links with lung and heart disease. It can not only trigger asthma, but it's felt that in children it may actually be able to cause asthma. The strongest link is with COPD, chronic obstructive pulmonary disease, and including fatal cases of this. It can also cause Alzheimer's, cancers, increased infection risk, as we mentioned, the risk to pregnancy and birth outcomes, and it's been shown to increase emergency room and hospital admissions, and of course is linked in isolation as a single pollutant with premature death. So what is a safe level of exposure given all of this information? Well, as I've been mentioning, as we learn more about the risks of exposure, the guidelines have become more and more stringent. Yeah. So the current WHO guidelines suggest a maximum exposure in a 1-day period of 25 micrograms per cubic meter of air, or sort of sustained annual exposure of no more than 10 micrograms per cubic meter of air. But in reality, or in fact, what we recognize is that NO2 does not actually have a safe exposure limit. We really are sensitive to any level. So let's now look at the health impacts of portlands. First of all, there's a history of poor local air quality here, as Peter so well described. Air quality in South Riverdale has been an ongoing issue for years, routinely exceeding the recommended NO2 exposure limits. And these are even the older limits that were not so stringent. A study was done back in 2012. And it suggested that a significant portion of air pollution, in fact, was arising from other sources, such as vehicles, buildings, and so on. But it also identified hotspots of poor air quality that were clearly being caused by large local industrial polluting sources, such as portlands. And I'm sorry if you can't all make out sort of the map that I've shown there, but what that is meant to show were the annual NO2 concentrations back in 2012. And in fact, I know you can't read the numbers, but all of the zones, right from the white to the black, in today's sort of standards, would in fact exceed the allowable concentrations. This is information taken from the National Pollutants Release Inventory, and again, sorry, it's a bit of a busy chart, but it's meant to show you that, first of all, NO2 is the main pollutant released by portlands. It is the area's largest single emitter of NO2, and it accounts for nearly all of the local industrial NO2 emissions in this area. And the emissions from portlands for NO2 have more than doubled over a decade. So this chart here shows you that by about a factor of 5, so City of Toronto is sort of the next biggest polluter, and you can see it was at about 54.5, and Portland's was at 250 tons. So it stands out. And this next chart shows us that in 2013, I put a little yellow box to show you that the output from Portland's was 218 tons, and in 2022 that went up to 509. So it more than doubled. Air quality modeling, again, Peter talked about the air inversions and plumes and all of this, and that's exactly right. I wanted to point out that the 2012 air quality report suggested that NO2 from PEC was mainly going to be a health risk at elevations of over 30 stories. But first of all, it's important to know that data relevant to the modeling, such as the frequency of starts and stops of the gas plant, were not provided by Portland's to the authors or the researchers, and that limited the modeling accuracy by making assumptions in lieu. And since the report, as we've heard, the recommended exposure limits are now much, much lower, and at the same time, the outputs of NO2 have more than doubled. So, yeah, so when we put this all together, as well with the fact that air quality modeling is notoriously variable. It depends on at least 3 different things: the actual pollutant amount and type, but also wind characteristics, which are constantly in flux, physical characteristics of the environment in question. So all factors considered, the risks due to NO2 exposure have definitely increased at closer to ground level since the 2012 report, but it is very difficult to calculate the exact ground level threat that is posed, but we know it's there. And as the science, so just to conclude, as the science of air pollution has grown then, we're learning we're more susceptible than we ever realized before to the health risks of this pollutant. There is no safe exposure limit. The catchment area around around Portland's already has unacceptable levels of air pollution. And as we heard, Portland's is the largest emitter, has recently doubled its output. And as well, we need to remember it is also the single largest greenhouse gas emitter. So again, that other pathway to health harm through carbon pollution. So PEC and TERRE must be held accountable as well for the entire life cycle of the gas that's burned at Portland's, including the known massive gas leaks and health harms that are inherent in the entire process, right from the fracking at source to distribution and delivery at destination. They must also be held accountable for the associated carbon pollution, which of course includes highly potent methane gas, which is 80 to 85 times stronger as a greenhouse gas than carbon dioxide, which is driving planetary warming well beyond this neighborhood as well. And I think that strengthens the argument that you can make from within this neighborhood. So it's directed twice by the City of Toronto. Portland should be urgently phasing out harmful gas-fired electricity to be replaced with renewables. This will yield huge co-benefits for public health, travel, lower the costs, and critically necessary environmental protections. So I'll conclude with just a little thought that the energy choices we make to power our homes, movements, and lives today are critical to a healthy, sustainable, livable future for all. And the graphic that I've shared on the left side here, I had the pleasure of visiting a graduate student exhibition of young urban design students at a regional college. And I was just blown away by the work that I saw there and the future that is imagined, the hope, the inspiration, and the really bright minds who are coming up with all of these. And that graphic was actually the award winner. It was hand-drawn. And there's so much that we can be, but we have to be there for this next generation to give them the chance and the opportunity to do that work that ultimately is going to benefit all of us. So just a final word from the Canadian Public Health Association to remind us that we are running out of time to do this. We're the final generation with the opportunity to avoid catastrophic climate change, which we need to treat like the public health emergency that it is. But this is our moment of greatest opportunity. So thank you all.